Good evening and welcome to this 14 Fish Facebook Live. So, sorry, somebody's head's just appeared on the side there. That's Liz, by the way. She's one of our admin team from 14 Fish who looks after the 14 Fish CSA and AKT packages. And I'll be telling you why she's here in a minute. Although if you've seen a Facebook Live with us before, you'll know exactly why she's here. So welcome, and tonight we're going to be covering the AKT. It's just less than 8 weeks now until the AKT, and that gives you plenty of time if you really focus your revision to massively increase your score. Every point in the exam is really important. I was doing some teaching with Health Education Northwest with their AKT group last week, and there was one candidate that failed by less than 1%. And so hello to all my new friends up in Health Education Northwest. I hope that some of you are watching tonight, although you're a great bunch and I think you're going to do brilliantly. And so what are we doing tonight? We're mainly going to talk about how to maximize your score using the AKT 14 Fish package, but I am going to give some general tips if you haven't joined us. There is still plenty of time. If you want to go to 14fish.com, you can join the package tonight and get started after we've finished. So my name's Mark Coombe, and I've been working with various registrars over about the last 20 years, and really looking closely as to why people do well and why people do not so well in the exam. And so the 14 Fish package is very much summarizing all of that stuff so that we can tell you the best way to maximize your exam. It's also interactive, and so you can interact with us on the 14 Fish package. We have a really vibrant AKT community where you can discuss with each other, you can discuss with us, you can talk about some of the AKT questions, and as I say, maximize where you are. The AKT package covers clinical medicine, statistics, and practice management, which, as you know, are the three main parts of the AKT exam. Clinical medicine, if you look at the stats from the last exam in April, clinical medicine was the commonest cause of failure, which it never was in the past. So obviously people are getting together, getting their act together as far as practice admin and stats are concerned. It does mean, though, even though clinical medicine is 80%, the other two are 10%. If you're weak in stats and weak in practice admin, make sure you mug it up just before the exam. Practice admin a bit harder to do than stats. Stats is relatively a small amount, and you can push your score up quite highly on medical statistics, relatively easy in a relatively short period of time. Practice admin, I'm going to give you a few tips about that in just a second. As well as that, we do focus quite a lot on exam technique. Exam technique can alter your score quite considerably. We've seen that over the last few years. And so there are some quite detailed things, all the way from just ensuring that you answer every question and finish the exam in the right time, but also techniques on how to get in the right frame of mind, how to turn up on the day and make sure that you scored the best score that you possibly could. Now, so here's how to revise clinical medicine. Let's start there. So clinical medicine is the biggie, 80% of the exam, commonest cause of failure this year so far. And a lot of you, when I was with Health Education Northwest, I asked them what they had done to prepare for clinical medicine, and they all said, we're just doing big question banks. You must not do big question banks. Question banks are okay if you use them to then go on and revise in GP-based clinical information. Because the vast majority of question banks, although there are 3,000 or 4,000 questions on some of them, they really are written by specialists in medicine and surgery, and they have very, very little to do with what's going to come up in the AKT. All of our questions, we're almost at 1,000 now, the questions on our AKT package are written by current GPs and people who've been involved with question writing at various levels in various exams. So you'll get a very good representation of what you're going to get on the day when you come and see what we're up to. There isn't any specific single trick on clinical medicine. The one thing I would say is you've got to focus your learning and you've got to do some learning. So as I say, doing questions, you just learn how to answer that question. You don't learn the background. You don't learn the principles. So what I've done is we created a series of clinical updates which cover all of the major topics that are going to come up in the exam. So diabetes, HRT, COPD, asthma, and we've also covered some of the big topics that recur every year. So focusing your revision on those, you will maximize your score. And so I've read the clinical guidance from different groups, so from NICE, SIGN, depending what's relevant to the exam, and I've put an exam interpretation on it. So hopefully by watching the short videos, they're normally between about 15 and 30 minutes, pausing the video as you go through. So you probably need to set about an hour per video. So you start the video and you pause the video if I say anything or one of the other presenters. Sadly, it's mainly me, but if you pause the video, if I say something you don't understand, and either listen to it again, or what you need to do is look it up somewhere else that will make it simple. So look it up in the GP update handbook, which is excellent. Look it up in look him up on patient.co.uk, or look it up in one of the clinical knowledge summaries that NICE produce, which are also very good. So you need to look at the videos. You need to get involved with a group or by yourself doing a summary of the BNF. Although people think that the BNF is just about pharmacology, and pharmacology only covers about 10% of the clinical medicine in the exam, that just isn't true. So the BNF isn't just about pharmacology. The BNF covers all of the major topic areas and the updated guidance on the stepwise management of things like asthma, diabetes, and so on. And so on our AKT community, there is a group of candidates at the moment who are summarizing the BNF. And if you go to the community and ask them to join, I'm sure you'd be delighted. Literally the last 4 or 5 exams, groups have got together and done it. If you're not in a group, don't panic. You can do it yourself, or you could form a group with other candidates by email. So you don't need to be in close proximity. So if you're stuck in an isolated area, don't panic. So what would I do? What am I? So what am I going to do in the next few weeks? Let's say the next 3 or 4 weeks. So halfway to the next exam, I'm going to do 10 of my clinical videos. Pick your big topics. Asthma, diabetes, pick the ones that you hate the most, pick the ones that you try and avoid in surgery, and I'm going to summarize the BNF. And I then want you to do 100-item AKT, so a timed AKT on the 14 fish past the AKT package, and then have a look at the results. Once we know where you are, we can give you some feedback as to whether or not specific areas, cardiology, what areas you need to now focus on for the last 4 weeks. And we can also look at how you do in the exam, whether your timing is good, whether you're reviewing technique. So when you answer questions, do you review well or do you review badly? Or like most of us, you're a neutral reviewer. If you don't understand what that means, it means at the end of the exam, you will tend to go back and look at some of the questions. There's a little review box. You tick the review box on the exam, and then you will tend to go back and review some of the questions. And some people go back and change the same number right as they do wrong, and so actually your score stays the same. Some people go back and are very positive reviewers, although they're not that many, and they'll change wrong answers for right. And there are some of you out there who which is quite common, about 10 or 15% probably, who go back and change right answers for wrong. So if you shouldn't be reviewing at all, because you're going to reduce your score if you go back and review. But we can see that once you've done a 100-item AKT with us. Whatever you do, don't just go to the 14 fish package and do questions. That's not what it's designed for. And in all honesty, you'll just start learning questions off road, which isn't helping. Okay, so clinical medicine, that's where I would start in the next 4 weeks. What about practice admin? So practice admin's quite a lot of stuff in there, lots of guidance and so on. The ones that I would pick out which would most increase your score in the next few weeks is DVLA, DVLA at a glance, which is all about the driving regulations. It's dead easy for us to ask questions in the live exam about how long is it you banned for after you've had a fit or a loss of consciousness, after a heart attack or a stent, because it's factual, it's either right or wrong. And so do have a look at that. Do have a look at prescribing controlled drugs. It's one of the commonest causes of complaint to the GMC, and it's one of the commonest causes of patient safety problems. And so it's easy to ask about conversion tables between one controlled drug and another, but also how you write a controlled drug prescription. That's really important. We don't write them very often now because it's all on computer, isn't it? So have a look at controlled drugs. Have a look at ethics. There are some very good ethical things about mental capacity, and the place that I would go to is the Bradford VTS. Great little site, used to be run by the Bradford VTS. And there's some really good things. Have a look at their ethical section. I really like it. And of course, there's our 14 Fish video on practice admin, which will give you lots of guidance as to where to look for the other aspects that might come up in the exam. And that's done by my brilliant partner at the surgery and also co-examiner Claire Matthews. Next is statistics. And as I say, it's an area that people hate. People don't like medical statistics. They don't like reading papers because they're all a bit complicated. But you are going to get 20 questions in the live exam, so 10%. 30 questions, so 10%. No, I'm talking rubbish. There's 200 questions, so 20 questions. And go to the 14 Fish library. Look at the stats presentation by Dr. Zaid Hermes, and it's a dry topic. It's a really difficult one to present, but it covers all of the aspects you're likely to be examined on. The other thing is get your practice manager to show you some of the CCG data. In practice, we're getting lots and lots of graphs and tables and things like that showing our performance, let's say on referral rates, prescription of antibiotics, between one practice and another, and you need to understand that. So get your practice manager to dig out a few of those things because you are going to see them in the exam. If you want to be a bit more detailed than that, and you feel you've got time, you've done lots of preparation already, then Essential Medical Statistics by Kirkwood and Stone is probably where I would go. Okay, so one of the things I wanted to quickly do, we have done it already for the last few AKT feedbacks that the RCGP give you, because particularly areas where performance was poor, you're likely to see that question again. So I'm just going to quickly go through those with you and talk about where you can get it. So this will be the feedback from AKT 33 in April. And if you have a look at a few of the last live AKT sessions that I've done, they will cover the ones before. So I'm just going to hand you over to Liz while I quickly grab my laptop and just get that list of things that came up last time.
If you have any questions, just leave them in the comments, and Mark does his best to answer as many as he can. And obviously, if you've got any questions about the online package that we provide, whether it's the AKT or CSA, the AKT or the CSA package online, then I can do my best to answer those as well. So do leave your questions in the comments.
Okay, so I think we had a few questions posted anyway, but I will just quickly run through it. So if you don't know about this and you don't know where to go to find it, then go to the RCGP website, and at the bottom of the list of under AKT is a little tab that says what's called feedback on the MRCGP applied knowledge test, and we're looking at feedback 33 if you want to have a look with me. And it does cover the statistics, as I said, about clinical medicine, and it looks at pass rates, and it looks at the reliability of the exam, which is 0.92, which is bionic. So, if you pass, you pass. If you fail, you fail. That's an indication of a very, very reliable test. So, some of the things that people improved on, as I mentioned earlier, is about basic statistical concepts. recognition of important infectious diseases. However, this knowledge was a little bit patchy, with candidates finding some common childhood infections difficult. And you may want to think about measles here. Measles, there's been an outbreak in the UK, as you know, and important that we pick it up. Areas causing difficulty for candidates: patient safety and quality of care, and that was all in pharmacotherapeutics. That was 2.02. The ones particularly there, controlled drugs, DMARD. So have a look at the rheumatoid arthritis presentation, and there's a couple of links in there into the tables, particularly monitoring of DMARDs, what you need to do with the different disease-modifying anti-rheumatoid drugs. Men's health candidates were not confident in the recognition of common lumps and bumps affecting male genitalia. That'll be a pleasant evening's reading. In care of people with ENT, oral and facial problems, candidates had difficulty with knowledge around management of hearing loss in scenarios where no action was appropriate. You don't always have to do something. So if the answer is none of the above, that may be the answer. Don't panic if you see that and you think it's right, if that's what you do in surgery. Care of people with neurological problems, say Parkinson's disease, Alzheimer's, all in the library. Do go and have a look at that. And there was candidates, clinical photographs. Candidates struggle with a number of things, including retinal and fundal images. So Liz and I are going to put up some retinal and fundal images over the next couple of days. So as I say, keep an eye on they won't be linked to a module. They'll be just in the mock exams. In fact, what we might do, I don't know if this is possible, is could we put some of the questions into the community? Or
yeah, definitely. I could definitely post about it so that people know when they're up, they can go on the practice. Perhaps
we could put them on a separate one so they don't have to keep doing papers or something.
So
we'll get some on for you. It's going to be your sort of classics: central retinal artery, central retinal vein, diabetic eye, that sort of stuff, papilledema. But we'll get you 10 or so up there in the next 48 hours. And so that was really the feedback from last time. And you know, that's got to be one of the biggest hot tips for the AKT. Okay, so where have we got to? Sort of.
I've got a few questions. So you mentioned not using question banks, and someone was wondering why.
Okay, yeah, people hate me saying this, but I promise you, using question banks. Unless you're somebody who's done loads of preparation all the way through your general practice training and using them to focus your revision, question banks are a complete waste of time. There is no evidence to support question banks whatsoever. You need to learn some stuff. The only the only package, including courses, the only online tool that has any evidence that that improves pass rates is the 14 Fish Pass, the AKT package.
So it's less than 8 weeks to the exam now, and someone's wondering if the Pass the AKT on 14 Fish will help them.
Definitely. So the biggest improvement we've had from anybody using so the biggest improvement from someone who's failed before and then sat again is 21%, and they did that over an 8-week period. We have had significant improvements in 5 or 4 weeks. Ideally, I don't want you to cram for this. Ideally, I'd like you to be doing this for 3 or 4 months, or even doing it from you know, ST1. And we're certainly looking now about encouraging people to start gently using the AKT package from ST1, and we'll just charge you once for the whole period of time. But if you're sitting in 8 weeks' time, you couldn't care less about that. You want to get on and maximize your score.
Someone else is just wondering, they're a bit confused about the asthma guidance, and they wondered which one will be in the exam. Okay,
so we've seen a lot of the questions like this in the AKT community, and what they're really asking is, NICE and SIGN produced asthma guidance over the last year or so. NICE came out most recently, and they are very contradictory. They are not the same. It is highly likely that you will be asked about the difference, and it's highly likely that you will be asked in the stem of the question in accordance with current NICE guidance or in accordance with current SIGN guidance. And if you have a look at the video, I go through that in some detail. So please don't forget to know the difference between the two. It's really important. They are not going to stick to just one, so you need to know the difference of both. If you're watching this and you're a trainer, then well, what we tend to do is advise currently that you use SIGN guidance as far as tutorials are concerned, just because SIGN is a much more practical approach and NICE is a much more aspirational approach. They talk a lot about pheno, which I don't know about you, but it's not available in my surgery. You can get it done in a local specialist clinic, but we just don't have access, so it's not really useful as a diagnostic tool.
Just a quick note, anyone who's joining us late to this, don't worry, the whole talk that Mark's just done will be online on our Facebook page indefinitely, so you'll be able to look back and see what Mark said this evening.
That's a worry. For my daughter.
It's on the internet forever now. And you can also leave questions in the comments. We'll be monitoring it over the next few hours and tomorrow as well, and we'll answer as many as we can even after the video. So I've just got one last question here. So what single tip for the exam day is most important?
Ooh. I always like it when Liz does the questions because she puts me on the spot, which, so I'm just delaying really, aren't I? So what would be the single most important thing? I think the single most important thing is to make sure you complete the paper. People tend to get a bit stuck. I find statistical questions, particularly with tables, and questions with lots of writing, they slow me down. I'm not a particularly quick reader, and I start to panic, and then that ruins the next few questions. So for me, I would go through the questions that I know, the questions that I don't immediately know, or there's lots of writing. I would guess an answer. I tend to guess the middle answer, which is C, and then I'll put it for review, and I'll review those at the end. I find then you're sort of getting on and suddenly 120 questions down, you've completed the paper and you've got plenty of time at the end to go back and read those questions where there's a lot of writing. So my big tip would be you must complete. If you're guessing the last 20 or if you don't get to the end, you really are putting yourself in trouble. So make sure that you complete the paper.
Cool, I think that's it for this evening. I don't have any other questions and no one else seems to have left any,
so nobody's put me on the spot, which is great. But, you know, it is 8 weeks. You can make a massive difference. You've got to focus your revision. And, you know, you can massively increase your score. If you failed before, you've got to just forget it. A lot of people who failed, it really drags them down. It's depressing. They've never, ever failed an exam before. It's miserable. And yes, it is. But actually, you can change something about that. What you mustn't do is keep doing the same thing. So if you failed last time just doing a question bank, stop doing a question bank. Come and join us and we'll get you through the exam. So I really wish you all the best of luck. Do ask some questions in the community and we'll see you the other side when you pass the AKT and you're doing the CSA. And we'll do a CSA live at some point later in the year. Anyway, good luck, everybody.
Yeah, good luck. Bye.